Mike Tyson returns to professional boxing 19 years after his last bout. There are neurological concerns for the 58-year-old by Sophia, Leah, and Madeline. What is the topic of the current events article? The topic of the current events article is the neurological concerns of Mike Tyson returning to boxing at 58 years old. The article that we chose to look into is a popular media article which is not peer-reviewed. The media source is CNN. What do you think the author's purpose for writing the article/current events piece is? We believe that the author's purpose for writing the article is to draw attention to the risks associated with re-entering a high-contact sport at an older age. Due to the nature of the sport and the high-frequency hits to the head, boxers can develop conditions such as, but not limited to, inability to sleep, chronic dizziness, and chronic Parkinson's signs long after they retire. The New York State Athletic Commission's medical standards have listed 2 factors as high risks for boxers. These factors include if the boxer is over the age of 40 and if they have been inactive in a professional setting for over a year. Tyson falls into both of these categories, which puts him at a high risk for developing neurological damage, which can impact him for the rest of his life.
How do the facts in the article compare to what we have learned about in class? The article insights align with what we've studied in class, especially the neurological risks that Mike Tyson faces. It highlights the concern for fighters over 40 because they are vulnerable to sustaining additional injuries. Boxing extends beyond the thrilling, powerful knockouts that excite the audience. While these dramatic moments capture attention, the real danger lies in the effects of repeated head trauma. Long-term issues can arise from the consistent blows to the head that boxers face during fights and training. These repeated impacts can cause structural changes in the brain, causing impaired cognitive abilities and emotional regulation. This is concerning for fighters because they may not experience immediate consequences of a knockout, but they are likely to face long-term neurological issues affecting their quality of life. Did the author accurately interpret scientific information in their article? What did the author inaccurately interpret? Yes, the author accurately interpreted the scientific information in the article. The details displayed about Mike Tyson and the neurological risks he faces are accurate. The article highlights that at 58 years old, he is at greater risk as older fighters are more vulnerable to health issues. There are concerns about potential chronic neurological problems he may encounter. Also, the author references insights from Dr. Sethi, who is a clinical associate professor of neurology at Weill Cornell Medical College, along with information from the World Medical Association. Overall, we found the author used accurate information and correctly interpreted their findings.
What makes this article trustworthy or untrustworthy? This article is not peer-reviewed. However, it is trustworthy because it includes input from Dr. Nitin K. Sethi, a clinical associate professor of neurology at Weill Cornell Medical College and a ringside physician. It highlights precautions taken by the Texas Department of Licensing and Regulation in regards to boxers over 40 years old. It includes concerns of the medical associations, including the World Medical Association, and it recognizes that neurological concerns for boxers have been a worry for almost 100 years, as American scientist Harrison Martland described boxers as punch-drunk after fighting in 1928. How might the current events article impact how the general public views the topic? This article highlights the dangers boxers face in terms of long-term health. It also shows that injuries that occur in the ring aren't necessarily the biggest worry. Repeated blows to the head for such an extended time can have cumulative effects that viewers don't recognize. Boxers can develop symptoms or conditions such as inability to sleep, chronic dizziness, chronic post-concussive symptoms, chronic Parkinsonian signs, and chronic traumatic encephalopathy, CTE, long after they retire. Our discussion questions for the class are: do you think there should be an age limit for professional boxing? If so, what should that limit be? And what are some ways the sport of boxing can change to help protect fighters from neurological damages?